Have you ever wondered how your food travels through your body after you eat it? Your digestive system, also known as your gastrointestinal or GI tract, is like a long, clever tube. It uses special muscle movements, called motility, to push food along its journey. This process is very important because it helps your body break down food and absorb all the good nutrients you need to stay healthy and full of energy. These movements are perfectly timed, like a well-rehearsed dance, making sure everything moves smoothly from your mouth all the way to the other end. It's an amazing automatic system that works without you even having to think about it. Gastrointestinal motility disorders are conditions that happen when this finely tuned dance goes wrong. The muscles or the nerves that control them in your digestive tract don't work the way they should. This can mean the movements are too slow, too fast, or not coordinated properly. Imagine a traffic jam inside your body. When things slow down too much, food and waste can get stuck. On the other hand, if things move too quickly, your body doesn't get enough time to absorb the water and nutrients it needs. These disruptions can cause a lot of discomfort and can really affect your day-to-day life. These problems can occur in any part of your long digestive tube. It might start right at the top, in your esophagus, which is the pipe that carries food from your mouth to your stomach. Sometimes, the issue is in the stomach itself, where food is meant to be churned and mixed. It could also affect your small intestine, where most of your nutrients are absorbed, or your large intestine, also known as the colon, which is responsible for absorbing water and getting rid of waste. Because the entire system is connected, a problem in one area can sometimes cause a ripple effect and lead to issues in another part. The key thing to understand is that motility is all about movement. The digestive system's muscles are controlled by a complex network of nerves, which act like messengers telling the muscles when to squeeze and when to relax. In motility disorders, there might be a problem with the muscles themselves, or the nerve signals might be getting mixed up. This isn't about a physical blockage, like something stuck in the tube, but rather a functional problem. The system is physically open, but it just isn't moving everything along correctly, which is why it can be so tricky to understand and diagnose. When your digestive system isn't moving properly, it can cause a wide range of uncomfortable symptoms. Because the problem can be anywhere from your stomach to your colon, the signs can vary a lot from person to person. One of the most common feelings is bloating, where your tummy feels swollen, tight, and full of gas. You might also experience a lot of abdominal pain, which can feel like cramping, sharp pains, or a constant dull ache. These feelings happen because food and gas are not moving through your system at the right pace, causing pressure to build up inside. Other very common symptoms are related to your bowel habits. If the movements in your colon are too slow, you might develop constipation. This is when waste stays in your large intestine for too long, making it hard, dry, and difficult to pass. On the flip side, if the movements are too fast, you can experience diarrhea. This happens when your system rushes waste through without giving the colon enough time to absorb water, leading to loose, watery stools. For some people, these two symptoms can alternate, making it very confusing and frustrating to manage. There are several well-known types of motility disorders. One example is gastroparesis, which literally means stomach paralysis. In this condition, the stomach takes far too long to empty its contents into the small intestine. Another very common one is irritable bowel syndrome, or IBS. While IBS is complex, it often involves problems with gut motility, leading to symptoms like cramping, bloating, diarrhea, and constipation. A rarer but more severe condition is chronic intestinal pseudo-obstruction, where the intestines act like there is a blockage, even though there isn't one, causing severe pain and difficulty with digestion. These symptoms can really get in the way of your daily life. The discomfort can make it hard to focus at school or work, and the unpredictable nature of symptoms like diarrhea can cause a lot of anxiety about being far from a toilet. It can also affect your appetite and what you feel comfortable eating, as you might start to associate certain foods with feeling unwell. It's important to remember that if you are experiencing these feelings, you are not alone, and there are ways to get help and start feeling better. Talking to a trusted adult or a doctor is the first step. If you are having tummy troubles that won't go away, a doctor can help you figure out what's going on. The first thing they will do is have a good chat with you. They will ask you a lot of questions about your symptoms, like what they feel like, when they started, and if anything makes them better or worse. They will also ask about your diet, your daily routines, and your general health. This conversation is very important because it gives the doctor clues about what might be causing the problem. It's a bit like being a detective, gathering all the information before starting the investigation. After talking with you, the doctor might want to run some tests to get a closer look at your digestive system. Some of these tests can measure how well your GI tract is moving. For example, a gastric emptying study can show how quickly your stomach empties food. For this test, you eat a small meal that contains a harmless radioactive substance, and a special scanner tracks how long it takes for the food to leave your stomach. Other tests can measure the muscle pressure in your esophagus or colon to see if the squeezes are strong and coordinated enough to move things along properly. In some cases, a doctor might need to see inside your digestive tract. They can do this using a procedure called an endoscopy. For this, a thin, flexible tube with a tiny camera on the end is gently guided into your mouth to look at your esophagus and stomach, or into your back passage to look at your colon. This allows the doctor to check for any inflammation, ulcers, or other visible issues. They can also take tiny tissue samples, called biopsies, to look at under a microscope. This helps them rule out other conditions and confirm if the problem is related to motility. Sometimes, imaging tests like X-rays or CT scans are also used. For some of these, you might have to drink a special liquid called barium that shows up clearly on the X-ray, outlining your digestive system so the doctor can see its shape and how it functions. All of these different tests help the doctor piece together the puzzle of your symptoms. By ruling out other causes and directly measuring or observing how your gut works, they can make an accurate diagnosis and figure out if a motility disorder is the reason you've been feeling unwell. This is a crucial step toward finding the right treatment. Once a doctor understands what is causing your symptoms, you can work together to create a treatment plan. One of the first and most important areas to look at is your diet. The types of food you eat can have a big impact on your digestion. For some people with slow motility, eating smaller, more frequent meals throughout the day can be easier on the stomach than 3 large ones. Your doctor or a dietitian might suggest avoiding high-fat or high-fiber foods, as these can be harder to digest. For others, increasing fiber and fluid intake might be just what's needed to help with constipation. Medication can also play a really helpful role in managing motility disorders. There are medicines that can help speed up a slow stomach, known as prokinetics. There are also medications that can help relax the colon to ease cramping and pain, or others that can help manage diarrhea or constipation. The type of medicine your doctor recommends will depend entirely on your specific symptoms and diagnosis. It might take a little time to find the right medication and the right dose for you, so it's important to be patient and keep talking to your doctor about how you are feeling. Beyond diet and medicine, there are other therapies that can make a big difference. One is called biofeedback. This is a clever therapy that teaches you how to control certain body functions that are normally automatic, like the muscles used for bowel movements. A therapist uses sensors to show you what your muscles are doing on a screen, and then guides you through exercises to help you strengthen or relax them. This can be especially helpful for people who have difficulty with constipation or bowel control. It gives you more control over your own body and can be a very empowering experience. For some very severe cases of motility disorders, when other treatments haven't worked, surgery might be an option. This could involve placing a special tube to help with feeding, or, in rare instances, surgically altering part of the digestive tract. The most important thing to remember is that there is hope. With the right diagnosis and a good treatment plan, most people with gastrointestinal motility disorders can find significant relief from their symptoms. It's a journey, but by working closely with your healthcare team, you can manage your condition and get back to enjoying a happy, healthy, and active life.